Welcome to another explainer from MediByte. Today, we're going to talk about a bacteria that's pretty much all around us, but can turn into a really serious threat in certain situations. We're talking about Pseudomonas.
So here's the big question, right? You've got this bacteria that's super common, it's in the soil, it's in the water, but it's also got this nasty reputation for causing some really severe, tough-to-treat infections, especially inside hospitals. How does that work? Well, let's jump in and figure it out.
Okay, first things first. Before we get into the dangers, we need to know exactly what we're dealing with. Let's unmask the culprit behind all this.
So let's meet Pseudomonas aeruginosa. This isn't some super rare microbe you've never been exposed to. It's actually everywhere. And it absolutely loves damp places. Think swimming pools, hot tubs, even the drain in your kitchen sink. It can even hang out harmlessly on the skin of totally healthy people.
Now, this is the key thing you have to understand about this bacteria. It's what we call an opportunistic attacker. What that means is it usually doesn't cause any trouble for healthy folks. Instead, it just kind of waits around for the perfect opportunity, for a moment when a person's defenses are already down, and that's when it strikes.
So if this bug is an opportunist, then the really critical question is, who is it looking for? Who is the most vulnerable? Let's take a look at the groups that need to be the most careful.
And this is the opportunity that Pseudomonas is waiting for. It zeroes in on people who are already in a tough spot. We're talking about patients in the hospital, people whose immune systems are weakened from things like HIV or chemotherapy, or those with ongoing conditions like diabetes or cystic fibrosis. Even things we use to help people like breathing tubes or catheters can accidentally become a superhighway for the bacteria to get inside the body.
Okay, so now we know who's at risk, but what do these infections actually look like? Well, they're on a huge spectrum, really, from something that's just a minor annoyance all the way to a full-blown medical emergency.
Really, it's useful to think about these infections in two big categories. On one side, you've got the mild external stuff that even healthy people can get. And on the other side, you have the really serious internal infections that usually hit those vulnerable groups we just talked about.
Let's start with the mild ones, because you might have actually run into these before. Swimmer's ear? That's a classic Pseudomonas infection. Or how about hot tub folliculitis, that really itchy rash you might get from a hot tub that isn't chlorinated well enough? Yeah, they're annoying for sure, but they're not typically dangerous.
But this is where things take a serious turn. In a hospital, this same bacteria can cause a nasty pneumonia, especially for patients on a ventilator. If it manages to get into the bloodstream, it can cause something called bacteremia, which can lead to shock and can absolutely be fatal. It can also cause really deep skin sores or even aggressive eye infections that can cause permanent damage in no time. And get this for a fascinating and maybe a little creepy detail. One of the telltale signs of a Pseudomonas infection in a wound is that the dressing might turn a distinct shade of green, and it can have a weirdly specific smell, sometimes described as being like grapes or even newly mowed grass. It's a very unique signature for this particular bug.
So let's say a doctor suspects a patient has a Pseudomonas infection. What's the game plan? How do they confirm it? And what's the plan of attack to fight it off?
Well, the process is actually very systematic. First, they'll take a sample. It could be blood, fluid, or a piece of tissue from the infection site. Then, that sample gets sent to the lab, where they'll try to grow bacteria from it. If Pseudomonas pops up, bingo, you've got your culprit. And then comes the final, absolutely critical step. They test that specific strain to see which antibiotics will actually work against it.
And as you can see here, the treatment is worlds apart depending on the type of infection. For something like swimmer's ear, a few antibiotic ear drops might be all you need. But for serious infection, like pneumonia, or one that gets to a heart valve, we're talking a much more aggressive response. That could mean weeks of powerful IV antibiotics, and sometimes even open-heart surgery.
And that leads us straight to the single biggest problem with fighting serious Pseudomonas infections: antibiotic resistance. You see, a lot of these strains, especially the ones you find in hospitals, have evolved over time. They've learned how to fight off multiple types of antibiotics. This makes finding a drug that works incredibly difficult, and it's a huge reason why these infections are so feared in healthcare.
Okay, we have definitely covered a lot of ground, so let's just pause and boil this all down to the most important things you should really walk away with today.
All right, here are the big takeaways. Number one, Pseudomonas is everywhere, but it's an opportunist. It mainly goes after people who are already sick or have a weak immune system. 2, the infections it causes are a mixed bag, from simple skin rashes to deadly internal diseases.
And finally, a lab culture is how you diagnose it, but treating it is a huge challenge that often needs heavy-duty IV antibiotics because so many strains are resistant.
So we'll leave you with this question. Knowing all this, how can we best protect the people who are most vulnerable? Well, the answer isn't some new magic pill. It's awareness. It's about understanding that this bacteria preys on weakness, which means good old-fashioned infection control and basic hygiene in hospitals and nursing homes are the most powerful shields we've got.
If you found this explanation helpful, do us a favor and hit that like button, share it with someone who might find it useful, and of course, subscribe to MediByte for more clear and simple explainers on the health topics that matter most. Thanks so much for watching.